got a job as a healthcare assistant, but his start was delayed while he had to wait for his national insurance number. The NHS is crying out for staff. When will the government get this sorted?
A report published earlier said the NHS in England needs a big push of domestic doctors, nurses and health workers to dodge a recruitment crisis. As per an internal document accessed by the Guardian newspaper, the NHS will face staff shortages of up to 571,000 personnel by 2036. Currently, the NHS in England is already operating with a shortage of 154,000 staff members. The document, which is under a ministerial review, aims to end the NHS understaffing crisis that's been hovering over the department for many years. The NHS also made some proposals to the government to achieve its target and win back public trust.
From time immemorial, the UK NHS has been experiencing a critical shortage of staff. There is shortage of staff in doctors, nurses, care workers, etc. As from February 2022, the UK has been hiring care workers from overseas, that is senior care workers and healthcare assistants, to also help alleviate the problem which the UK is facing. So in the past 2 years, the UK has been benefiting from overseas care workers. However, last year there was an outcry that migration levels were too high, and of note, care workers brought in over 120,000 dependents together with them to UK. And in an effort to bring migration levels down, James Cleverly and the government of UK took the following steps.
We will stop overseas care workers from bringing family dependents, and we will require care firms in England to be regulated by the Care Quality Commission in order for them to sponsor visas.
So following these measures, with effect from the 11th of March 2024, care workers are no longer able to bring their dependents from overseas. So this is devastating news for all overseas care workers who are willing to relocate to come and work in the UK. So following these measures, on the 2nd of May 2024, the Home Office gave an update on what has been happening in the past 4 months with regards to the health and care worker visa. And in this video, I'm going to be sharing with you the update. If you're new to my channel, my name is Pauline Popomoyo, and in this channel, I share information on how you can relocate to overseas without breaking a bank, and I also share information on life in the UK in general. And if that sounds like something you're interested in, do smash that like button and subscribe to my channel and turn on the notification bell so that you never miss any of my videos. And without wasting any of your time, let's dive right into the video. So guys, as you can see, this article was posted on the 2nd of May 2024, and this is from Nursing Times, and it clearly states that concern over a massive 83% decline health and care visa applications. It states that social care leaders have warned of the catastrophic impact that visa tightening policies have had on the sector, as new figures lay bare the extent health and care visa applications have plummeted in the last year. New figures from the Home Office published this week have revealed an 83% decline in the number of monthly applications for skilled worker health and care visas. The situation is now likely to become even more dire for a sector wholly reliant on its overseas workforce to fill the vacancy chasm. Latest Home Office figures have now shown that just 2,400 people applied for a skilled worker health and care visa in March 2024 compared to 14,300 in March 2023, a massive 83% drop. Meanwhile, some 13,200 people applied to be on dependent visas in March 2024 compared to 16,700 in the same month. That is a 20% decline. I don't know what you think of these figures, guys, but in my opinion, I think the Home Office has not been issuing the certificate of sponsorship to quite a number of people, meaning very few people are going to be applying for visas. Hence, the massive decline in the number of people applying for the health and care worker visa. If the Home Office was issuing the certificate of sponsorship timeously, I'm sure the numbers would be a bit higher. Anyway, that's my opinion, but this reduction, 83% reduction, is now a great cause of concern in the UK, and this is what they are saying about this decline in the number of care visas being applied for. Speaking this week, the Chief Executive of Care England, Martin Crean, said the latest Home Office figures had contradicted the government's own estimation of the impact of the policy. With the policy now in place, the sector has been left to pick up the pieces, he explained. While we all want to see a sector that can be sustained by domestic labor, there is nothing to suggest the government's workforce reforms have made the sector a sufficiently attractive destination for work such that it can cope with this drop in international applicants. These figures only serve to renew the new need for meaningful workforce reforms that make the sector an attractive destination for domestic staff if we are going to shut off the route for overseas recruitment. As you can see, guys, disaster is looming in the UK. As of May 2024, they clearly stated that there are 152 vacancies to be filled here in the UK, and the government promised that they will strive to fill in the vacancies with domestic workforce. They intend to make care worker visa route, or rather care work jobs, more attractive and increase the pace. But according to the Nursing Times, all that has not been happening. There is nothing to show that there are some changes taking place, and there is nothing to show that there is more staff here in the UK that they're going to hire to fill in all those vacant positions. Yes, they feel like there's going to be a catastrophe here in the UK. This is what they said. The situation is now likely to become even more dire for a sector wholly reliant on its overseas workforce to fill in the vacancies. Unless the government gets a grip soon, reforms care and boosts wages for its highly skilled workforce, the situation will soon become catastrophic. So guys, if you were the government of UK and you hear such news about your country that the healthcare system is going to go to dangerous levels because a catastrophe is a massive disaster, what course of action were you going to take? Do let me know in the comment section that if you were the government of UK, what action would you take if there is such a threat to the healthcare system? So guys, I'll let you know shortly what the Home Secretary has said with regards to the new statistics. In the meantime, nursing leaders have accused the UK's government of cruelty and endangering health and social care services after this announcement. And guys, they've been asking the government of UK to reverse this new rule. But according to James Cleverly, this data shows a significant fall in the numbers of first-of-hour measures to take effect, while it's underlining why necessary action was taken to cut unsustainable numbers of care worker dependents. This does not mark the end of the road in our plan to cut migration. There is more still to come. Over the coming months, we will continue to show the pace of our progress as we deliver the control the public rightly expects. So guys, as you can see, this is the current situation on the ground in the UK. It appears as if there's a tug of war between the healthcare sector and the new government policy, and the government of UK is continuing to endeavor to cut down migration levels to UK, while the healthcare sector is crying that the reduced numbers of care workers coming to UK is going to debilitate the healthcare system. In my opinion, it's high time a petition is written to the government of UK to ask them to please be lenient on the overseas care workers and enable them to bring in their dependents from overseas. Anyway, time will tell. We are going to see how all this is going to pan out. In the meantime, do not give up on your dreams. If you still have a dream to relocate to UK as a care assistant, the health and care worker visa route is still open to overseas applicants. You can continue to apply. If you need help in creating a standard UK CV, a cover letter, or the NHS supporting statement, do utilize my services. The link is going to be in the description box, and I'm going to create excellent CVs and supporting statements for you so that you increase your chances of getting a job here in the UK. Otherwise, guys, this is the update that I wanted to give you on the health and care worker visa. If you have any questions, do drop them in the comment section. I will gladly answer all of your questions. And guys, if you haven't subscribed to my channel, do smash that subscribe button, turn on the notification bell so that you never miss any of my fantastic videos. Thank you so much for watching, guys. I will see you in my next video. Bye.